Are you looking for relevant healthcare information? Log on to Medicircle and watch experienced medical professionals talking on common healthcare topics. Stay informed, stay healthy, stay tuned to Medicircle.
At Medicircle are constantly working on bringing to our audience all the trending health related topics. It is our primary objective to bring to your attention news and views you need to be aware of to lead a healthy, disease free life. To help us in this regard, we'll be joined by eminent and expert top doctors from across the country. Today in Dr. Speak, we are going to talk about the problem of diabetes and ways to help you deal with it. Hello, this is Aprajita Mehra and you're watching Medicircle. Today on our Diabetes Awareness series, we have Dr. Vinod Methil with us. Dr. Vinod Methil is a senior consultant diabetologist practicing in Navi Mumbai for last 16 years. He has done his MBBS and post-graduation diploma in diabetology from Topiwala National Medical College and BYL Nair Hospital, Mumbai University. He has also trained in the esteemed All India Institute for Diabetes, SL Raheja Fortis Hospital, and was a clinical associate there for 2 years. He has worked in United Kingdom NHS in medicine for 2 years too. As of now, he is currently consultant diabetologist at Reliance Hospital, Navi Mumbai. It is our privilege and pleasure both to welcome him today to Medicircle. Hello, sir. How are you?
Thank you for calling me to this Medicircle meeting today. And I'm so privileged to be speaking on this forum. Thank you so much. I'm good. Thank you.
You're most welcome, sir. And actually, we are so looking forward to doing this interview with you. So, sir, without further ado, let me just move on to my first question for the day, and which would be that, is diabetes drugs immunosuppressant?
Well, the answer for that is it's definitely no. Diabetes drugs which are used for treating diabetes, they are not immunosuppressants. And basically, these drugs basically act either by increasing the insulin action or pushing the pancreas to secrete more insulin, or there are certain drugs which act on the kidneys and helps to, push out glucose in the urine. So the mechanism of action is quite different as compared to the other drugs. There are drugs which can be immunosuppressants, like steroids and other disease-modifying drugs, but these drugs actually causes the blood sugars to go up. The drugs which we used for treating diabetes, they do not suppress the immunity in any way. But then we need to realize that it is diabetes which is an immunosuppressive state. The high blood sugars can actually suppress the immunity of a person's body, and they do it by various mechanisms. They affect the body's fighting mechanism, the cell mechanisms which are responsible for killing bacteria, fungus, or viruses, or the other cells which secretes various antibodies. These two can be affected by high blood sugars. They suppress the immunity. So by treating diabetes, actually by these drugs can actually improve the immunity. And this was also seen in the recent COVID pandemic, where it was found that the people with diabetes whose blood sugars were uncontrolled, for them, the risk of getting an infection and mortality was found to be very high. So it was found that it's very important that you keep your diabetes under control and during this pandemic.
Right. So essentially, what I have surmised from this is diabetes has its own set of problems, and which might be, a deterrent to our immunity, and which might, hamper our immunity in some way. But other than that, the drugs in itself are quite, harmless, and they do not act as an immunosuppressant. Right, sir?
Yes, yeah, that's very right. Diabetes drugs, they don't suppress the immunity as such.
All right. So, doctor, moving on to my next question. Are diabetes and thyroid problems related to each other in any way? What is your take on that?
It's a very, very good question. I mean, the answer for that is, yes and no, you can say. So for that, we need to know the different types of diabetes. So basically, there are two important types of diabetes. First one is which we call as type 1 diabetes, and type 1 diabetes happens basically because of what you call as autoimmunity, where antibodies are formed and which destroys the pancreatic cells which secrete the insulin, and the patients become insulin deficient. Now, in patients who have got type 1 diabetes, in these patients, the risk of getting a thyroid problem is on the high side. You can see 1 in 3 patients of type 1 diabetes can get thyroid problems also, because the reason for this, even the thyroid problems, the thyroid illness, they are also related to autoimmunity, or they're also related to antibodies. So because of that, the risk is a bit on the higher side. But when it comes to type 2 diabetes, the common form of diabetes which is happening, you can say that about 95% of diabetes happens is type 2 diabetes. So in these patients, again, the risk is slightly high. It's not that high as we see in type 1 diabetes. You can say about 10 to 12% risk is there of these patients getting a thyroid problem, and the exact cause is not known for them, and it's probably because of the aging process and that way. But otherwise, the association, as I said, is it's different in different type of diabetes. And then there's another important aspect which we need to remember when we are talking about diabetes and thyroid problem is the impact of thyroid problems on the diabetes control. So these hormones have got an effect on the diabetes control. So when you have got hypothyroidism, when your thyroid levels are low, then the blood sugars also tend to go low, because the hormones, the thyroid hormones are basically associated with the body metabolism. And when your thyroid hormones are low, the insulin usage also comes down, and therefore blood sugar starts going down. And if you've got hyperthyroidism, when your thyroid hormones are in excess, then the blood sugars tend to go up. So this has to be taken into consideration when we are treating patients who have got diabetes along with a thyroid problem.
All right. Now that this both seem to be, problems related to each other also, and in some way they are both associated with obesity, as much as I have realized through experience and talking to people and the kind of questions that we keep pouring on our website. So, is there a connection between these two and obesity also?
Yes, definitely, especially for type 2 diabetes. We know that the most important reason which we find today in our generation, the reason for type 2 diabetes is obesity. And obesity happens because of our lifestyle, our diet and exercise, which is getting affected in the current scenario. This results in patients putting on weight gain because there's increased calorie consumption, lack of exercise. The calories which are consumed are not burnt, and then you get obesity. And basically there's more of the central obesity, where you get more of tummy.
Yes.
And it's been found that the fat which is present in the tummy, they
Yes.
can secrete some hormones which can affect the insulin sensitivity and insulin action, and this can in turn result in with the patient getting type 2 diabetes in future. And then hypothyroidism is again it's a problem where the patient starts putting on weight. So it's quite interconnected. I mean, obesity, thyroid, and obesity, it all comes in together, and the problem exacerbates.
So true. And as much as I thought, it was almost there. So thank you for explaining that part to me. So my next question would be, can diabetes in any condition be ever fatal for a patient?
Yes, definitely. The answer is very, 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 I mean, it's definite yes. I mean, if you look into data, what we see over all over the world currently, there's around 1 to 1.5 million deaths happening annually, which is due to diabetes. So diabetes actually can affect the body in various ways, and it can affect your kidneys, it can affect your heart, it can affect your eyes. It's one of the biggest risk factor for heart problems. And if you see that 80% of the diabetic patients, they usually die because of heart problems. So that is such a huge connection, and the big association between diabetes and heart problems. And then there are other problems which diabetic patients can get, like kidney failure, which can happen with long-standing diabetes. People end up with dialysis. And again, if you see the patients who are on dialysis, 2/3 of them are because of diabetes itself. So diabetes is a big reason for kidney failure, which again can lead to mortality later on. Then, as I said before, diabetes can affect your immunity. It increases your risk of getting various infections. So again, the risk of mortality goes up, blindness, and then it affects your blood vessels. You must have heard people with diabetes getting gangrene in their feet, amputation happening. It's all because of diabetes. So diabetes is one of the root cause which can lead to severe other complications, which can finally lead to mortality.
Very well explained there, sir. Thank you so much. Which allows us to come to our last question. And that would be, can diabetes be reversed, sir?
Yes, I mean, that is again a very in thing you can say. I mean, this is coming out a lot in the social media recently, or everybody's talking about reversibility. So first important correction is that it is not reversible. The various societies have mentioned that it's not reversible. The term should be remission. Okay, so
All
when can remission happen?
right.
Remission happen is that when a patient who has been diabetic, he becomes totally drug free. His A1C becomes less than 6.5, and he's able to maintain that remission for more than 3 months. So at that stage, you can say that this patient has got into remission. Why remission is because that it can be re-reversible. Okay, so if the patient who has achieved this, who has got a remission, if he doesn't follow a lifestyle, good lifestyle, and if his weight, he starts putting on weight and everything, his sugars can again start going up. So again, he can
Yeah, you
become
can go
a
back to the
diabetic
same
patient.
state. Right.
Same state which he has been. So it's not that once he has achieved a remission, he can be totally stress free. He can go back to his old lifestyle. It's not like that. He'll have to maintain a healthy lifestyle. So now coming to the main point, is it reversible? Yes, it is reversible. Again, the important point here is that for whom it can be reversible and how it happens. So initially the thought, about a few years back, the thought was that the diabetes, it's a chronic and a progressive illness. So once you get diabetic, you're going to remain a diabetic for the lifelong. But then there are reasons, good studies which have come, especially the direct study from United Kingdom, which has actually shown that certain group of patients, if they are able to achieve more than 15% of their 15% of the body weight loss, they're able to achieve that in a very lesser period of time, stringent period of time. Then in certain group of patients, you can actually get a remission of diabetes. And why does that happen is, again, we come back to the problem. The important reason for diabetes being obesity. And when the patient puts on weight, there is deposition of fat in the liver and the pancreas, and this fat which is present over there, they actually can impair the secretion of insulin as well as the action of insulin. And what is achieved when you get a very good weight loss of a very short period of time is that you reverse this. The fat content comes down, and even if you lose just a gram of fat in the pancreas, your insulin production can rebound back. So with that, your diabetes kind of goes into a remission. So very important point here is that a good weight loss, almost 15% of your body weight in a period of say about 3 to 6 months, that should happen. And then only the patients this can be achieved with only very, very low caloric diet. Now, is it reversible for all? No, that is not. It's not reversible for all. That is also very important. That was even seen in the studies. That in the studies, what was seen is that just about 46% of the patients, they could only this percent of patients could actually achieve a remission. So a good point was, it's not going to happen to everybody. That needs to be remembered. So whom can it be possible? It's usually possible for patients who have had a diabetes for a shorter duration of time, usually less than 5 years, and best if it is less than 2 years. I mean, these are newly diagnosed patients, and for them it's possible. Second thing, usually younger group of patients who are not taking too many tablets or medicines for this thing, and who are quite overweight, and who are quite otherwise physically and mentally healthy. So for such group of patients, it can happen, not guaranteed as well, but there's a very good chance that they can go into remission. And again, as I've said, they have to maintain that. It's very much possible to go into remission, but to stay in remission, you will have to maintain that lifestyle, that diet and exercise. You have to keep that weight constant. Then only it's possible that you stay in remission. Otherwise, you'll go into reversal, where your blood sugars will start going up.
So as much as most of the patient would like to believe, there is of course a streak of positivity there that you have a remission of this disease. But contrary to popular belief, this lifestyle disease could be managed well, but cannot be completely cured. So ideally, you should stick to a healthy lifestyle. So I would like to thank Dr. Vinod here for sharing his valuable insights. So on behalf of everyone here at Medicircle, I would like to thank him for joining us. And it was really a pleasure having you today, sir, on this show. Thank you so much.
Thank you. Thank you so much. Thank you, Abhay. Thank you, Medicircle. Thank you so much.
Thank you, sir.
Bye.